Hey everyone, this is Megan.
And Darla. We are your hosts of the Enlighten Benefits podcast.
Our goal is to help you understand all things insurance. In each episode, we will tackle the confusing topics and terminology as it relates to insurance.
We want to create confidence over confusion and make insurance suck less.
We hope you enjoy our show. All right. We are on this series of Medicare Made Easy. In previous episodes, we've talked about Medicare Part A being hospitalization. We've talked about Medicare Part B being your doctor's visits. We've given the audience all kinds of information about Medicare supplement plans, the whole alphabet around that. We've also talked a little bit about Medicare Advantage plans. The one thing we haven't talked a lot about, Darla, is drugs. Medicare, not illegal drugs. I mean,
right.
like Medicare Part D, prescription drug coverage. Want to talk about that today?
Yes.
Let's do it.
That is the one thing that when you do see the words penalty in the Medicare Guide to You, Medicare Guide in You see the word penalty around the Part D. Mm-hmm. And it, I just drew a blank. Hold on.
Speaking of turning 65.
Maybe I'm not talking about marijuana. Does anybody have a joint?
Yes.
Don't ask if you don't want it.
Okay. We were talking, let me see if I can remember you. We were talking about penalties, prescription drug coverage. This is where Part D, you can or will, if you don't sign up for Part D when you turn 65, you will be assessed a penalty.
Yes, I think it's tied to your part when you turn on your Part B.
Correct.
So we had mentioned in earlier podcasts about whether to not to turn on your Part B. I'm working, I have company coverage, those different things. So the D, as in dog, is tied to the B as in boy. So whenever you can prove to Medicare, and they will ask for a letter of creditable coverage.
Right, from your employer.
From your employer.
Right.
So don't get scared when you see penalty, because if you have company coverage and you're still working, then you do not have to enroll in the drug plan, and you can avoid the penalties with a letter from your employer. So the penalties, if you really want to dig into when a penalty would apply, and I've had one client in my career that did not sign up for a drug plan whenever she turned 65. She's now, fast forward, she's 92 years old. She just got diagnosed with COPD, okay. Needed an expensive heart medicine. Mm-hmm. And she's been on Medicare and a supplement all this time, just paying cash for her prescriptions, because a lot of times you can just pay cash, sure. Right?
Sure.
And you find out that it's cheaper to do so.
That's what I was going to actually ask you is, I hear, clients say, well, I don't take any medications. Why do I want a prescription drug plan? And that's a conversation we have to have, because last year, the cheapest drug plan was around, and again, I'm giving like a very ballpark figure, was around $12 a month. And so as we were kind of figuring, that's going to cost you $120-ish per year, and you're not really using it. So then we have to go back and think about, what is that penalty going to look like, right? And kind of assess that.
Yes. So, and that's exactly with my 90-year-old lady. She didn't take one out. Now she's on an expensive med. Mm-hmm. So her drug plan, like you said, was going to be $13. Okay. I mean, mm-hmm. just a very cheap drug plan. But her penalties, which had accrued, over the years, which that will actually go to either Social Security or Medicare. They're going to want that penalty. And it is a certain percentage. It's a big, long calculation on how they do the penalty. And I wouldn't even waste the time to go into how that works. But it's a certain percentage of the cheapest drug plan in that year. And then it accrues and builds to where they added that on. And I want to say, Megan, that her penalty was like $45 a month.
Wow.
So a $13 drug plan plus a $45 penalty,
Right.
because she never enrolled in one. So, it was just really sad. It was really sad, and probably no one ever explained to her that she was accruing that penalty if she didn't take out a drug plan.
Sure. The other thing you can do is I've had clients that have said, well, I don't want to do it this year. But it is a smaller penalty amount if you choose not to take out a drug plan for the first 2 years, right? So when you're 67, 68.
That's fair.
So yeah, I mean, sometimes it's, again, with my clients, I will just assess what that penalty will be. And again, I think it's just so important to be educated, right? Just so that you know what you could be faced with if you choose not to take out a drug plan.
Yeah. And this just brought up another point. I was just thinking, if you are a veteran, we talked about veterans before.
Yeah.
If you're a veteran or a Native American, then you will not accrue a penalty. So you can actually not do a drug plan. And then if you're 90 years old, if you're not going to be able to get that prescription from the VA or the Native American, then you can enroll in a drug plan and not have a penalty.
Gotcha. Yep. I forgot about that. So the other thing that I think is worth mentioning is not everyone is going to be able to pick their own drug plan. So we've talked about in previous episodes of our podcast about the difference between a Medicare supplement and a Medicare Advantage, right? So only the people who choose to do the supplemental plan, and we kind of referred to Part G, or Supplement G, those are the only people that are going to be eligible or able to choose their own drug plan. Because with an Advantage plan, I think it's worth mentioning that your drug plan comes with the Advantage. You don't have this option to take out or not take out a Part D plan. Right?
Kind of similar. I mean, would it be fair to say, Megan, that it's kind of similar to health insurance?
Yeah.
Because you've got your copays and your drug plan. I mean, your prescription drug coverage, everything is included in your health care.
Sure.
So,
right. Yeah.
If you're looking at it that way, from I'm retiring and coming off of group insurance, then yes, an Advantage plan bundles everything under one title.
Right.
So, standalone drug plans would only be needed if you were on a supplement.
Right.
So you've got original Medicare, you've got your supplement to Medicare, and then you're going to have your drug plan that will be tied to Medicare.
And then whenever we look at drug plans, again, the government kind of expects for individuals to go on and figure out their own drug, like which drug plan that they want to use. And it's kind of confusing, I think, for some of my clients, because maybe, for example, we will do a Mutual of Omaha supplement, but then we will do a Well Scripts or Well Choice, or we will do a completely different brand for drug plan. Do you hear that? That's kind of confusing for some people.
Oh, absolutely. I've had people that have done a Blue Cross and Blue Shield supplement, and then they feel like they need to do the Blue Cross and Blue Shield drug plan,
which is absolutely not the case.
No, it's all individually based. And I think this would be a good time to point out, at Enlighten Benefits, we actually shop your drug plan for you. We don't represent Medicare ever. But everybody has access to the Medicare.gov website. I have some clients that are very techie people. I'm not one of those, but they can go in and select their own drug plan, put in all the information. It's kind of confusing because they on the website, they want to know why you're enrolling in a drug plan, and there's 25 different reasons. So you kind of need someone sitting with you, with us, so we can kind of go over those questions with you. But we actually include the Part D drug coverage search. We will sit there with you and do it with you or do it for you. and plug in all that information. The Medicare website is actually amazing because it takes into consideration your zip code, what pharmacy you're going to use, what prescriptions you take,
right,
whether they are, and don't let this scare you people, but it's like there's so many levels of prescriptions. So you've got your tier 1, tier 2, tier 3, all the way up to tier 5, which is your specialty name brand. If you hear a cute little ditty on TV about a insulin or some type of a medication that just came out, you probably won't be able to afford it.
Right.
So,
or you're going to pay a lot for it. Yeah.
Absolutely. So that's going to fall into your tier 5 categories. But so Medicare will take all of that information that you plug in and calculate it and then spit out the least amount of out of pocket for you for the year.
Right.
So
I do think that their website is, once you get the feel of it, I think it's very user friendly.
Yes.
But that's where, I don't mind at all helping my Medicare clients just because I am in there every single day. I'm working with that website, so it's very familiar to me. But I've said this before, I think knowledge is power. And so I like to show clients how they can also access that information if they just want to get on there and kind of look around and figure it out. I also think it's important that, we've said before that once you sign up for Medicare A, B, and your supplement, you don't want to change any of that, right? You want to stick with it. You don't want to make a lot of changes unless something serious happens. And those are going to be very few and far between. But I do think with your drug coverage, that is the one thing to be mindful of that can change every year if it needs to. So I always tell my clients, if you've had, if you've added a lot of medications, or if you've dropped a lot of medications, or if you have decided, hey, I don't want to get my medications filled at ABC pharmacy, I want them to be filled at XYZ pharmacy. That's always a time for either you to do it yourself or call me, and I don't mind helping between those enrollment periods of October 15th and December 7th. If you want me to look at it at least every couple of years, let's take a look at it, because I want to make sure that you're paying the least amount possible, right, for your prescriptions as well as your coverage plan.
Yes, because if you don't do anything during that time, which is called general enrollment, and that is the open door for everybody that's on Medicare, even Advantage Plan people.
Sure.
That's your, like you said, October 15th through December 7th, big dates to remember when you're 65 and over. That is when you can change your Advantage Plan. You can go from community care to Humana, or, go from a silver to a platinum plus.
Right.
Then it's also time when you shop your drug plans. I have had a scenario where someone did not look at their update on their drug plan. Mm-hmm. And it went from like $6.70 in January. It went up to $55.
Oh my gosh.
This happened about 5 or 6 years ago. And the people who didn't read the notification of their drug plan, that's their legal, they notified you, they gave you that document, they told you what your new rate was going to be in January. Well, when I get phone calls after January 1st.
Sure. When it's gone into effect.
It's too late.
It's too late. Yeah.
So
it's too
you
late.
are going to pay that $55 for the whole year until open enrollment, and then it will be January the following year. Or you could just drop your drug plan and take the penalty for a year. I mean, there are options, I'm sure. But yes, you want to be really careful whenever you're on a standalone drug plan to look at that flyer that they send you, which is always a good time to pick up the phone and call us and say, hey, this is what I just got in the mail. This is what's going to happen to my drug plan. What do I need to do?
Sure. So we think we've covered the part D, the drug plan. The other thing I wanted to talk about today was these acronyms that are associated with Medicare. So this is confusing for a lot of my clients. IEP, SEP. You want to dive in just the next couple minutes and talk about those little acronyms and what those stand for?
Yes. So you have the IEP is your initial enrollment period.
Right.
And